Right. Good afternoon on a Saturday, and the time is continuing. As I said, this weekend, going to early next week, is an important one. We want to monitor how we're doing, and mostly how well everybody is staying to the task of social distancing in all the venues, whether you're staying at home, whether you're out in public places for a short period of time. If you have to go and urgently need to go, you maintain those aspects. If you're doing essential services and essential purchases that you need, you respect those things, respect the retailer who has taken the time to come out and to undertake their duties, and they're trying to respect that as well. And ongoing hand hygiene, of course, in that regard. So these are all very important times to do it again, and do it well, and do it consistently. And we're going to continue to monitor that situation. As I said, I'm concerned at this time with the amount of people returning to Ontario who might have been infected, or at least incubating from other countries or from other contacts with cases, that we need to be vigilant in that everybody needs to do it. Those who come in are being asked to isolate when they come across the border for 14 days. And we are anticipating and expecting them to do so, regardless of age and where you've come from. And also those from flights, the same rules in that regard. So everybody knows what the plan is and how to do that. We just need to do it and do it well. In light of that, we're seeing some rising numbers, which I said yesterday I would anticipate because of the number of people coming back and the time, perhaps since they came back of their incubation period, we will start to see some numbers rising. So I'm going to ask Dr. Yaffe to talk about the numbers that came in, what we're working with today, and to update you on those various aspects there. So over to you, Dr. Yaffe.
Thanks very much. So as of yesterday, the data from the end of yesterday, we have a total of 377 cases confirmed in Ontario. Of those, 6 are now resolved, and unfortunately we have a third death. This is an individual, a male in his 70s in Barrie, who was a close contact of another individual who has died. In terms of the, we still have 7,239 people under investigation, and a total of 15,768 negatives. So in total, we have tested to date 23,384 people. The numbers are going up. In terms of cases, we have 58 new ones today compared to yesterday's data. In terms of the cases themselves, we have data that shows that over 50% have traveled outside of Canada. About 12% were close contact of a case. And of those that had traveled, almost 30% had traveled to the United States, most commonly New York, Colorado, California, Florida, and Nevada. And after that, the next most common travel was to Europe. So basically, we're looking at mostly travel and contact with a case. Very small number still under investigation, or at this point we have approximately 20 cases in Ontario with no identified source. Thank you.
Thank you. And monitoring the global situation, the numbers in the United States continue to rise fairly quickly. Cases are now over 20,000. And unfortunately, the situation in Italy, in spite of all the stringent steps they've taken, the number of cases continue to rise extensively, and unfortunately, so do the number of deaths in that regard. And so I think with that in mind, you have to be sensitive to where all the different travel issues, what different countries have done. We've understood that since they have eased off or some of the aspects in Wuhan in China, now for at least 2 days they've had no cases reported publicly in that regard. And it seems like there are other cities that were not in any the same type of lockdown as Wuhan have remained quiet in that regard as well. But we continue to monitor their situation because they, of course, are the first to go through this kind of activity. And we need to monitor it and learn from what they're experiencing and what they have experienced in that regard there. So the aspect here we want to emphasize is that, as I said yesterday, it wouldn't surprise me if our cases over the weekend rose to over 60. We're close to that today, and we continue to do the testing. We're ramping up the people are working around the clock to increase our capacity. We're well over 2,000 now, heading to 3,000, but we would like to get to 5,000 fairly quickly, and working on that at all fronts. Our surveillance continues in that regard, monitoring those other people in emergency departments as well as long-term care homes. And those ones there, we still have had no positive, with over 2,000 tests being done, 2,100 about. And the Trenton situation is remaining stable, with the 6 non-Ontario residents and 6 Ontario residents having converted to positive during the time in the quarantine in Trenton. So with that, I think it's more important we get to, one, to emphasize the key priority today is ongoing vigilance in your home situation there, minimalizing your external social contacts. Do so when necessary, if it's really critical. Essential services are there for those that need medication, those that need food, those that need other things that are critical for day-to-day living. But as I said before, when you do go out, along with the person who's operating that retail center, they'll do their part to maintain the social distancing, the hand hygiene, and all the other key components. And you need to do the same. And by doing that, you minimize and eliminate the risk to yourself, and then later back to your family members accordingly. So with that, we're going to take questions, and they're all in line today. So I'll hand that over to our moderator to take the questions.
Okay, we'll take the first question now. Hi there, we'll turn it over to the phones. First question, please.
Your first question on the phone comes from David Haynes, Queen's Park Briefing. Please go ahead.
Hi there, Dr. Williams. One major issue has been trying to ramp up testing. And so I was hoping that you could help explain what some of the challenges are to ramp up testing right now, and the timeline of when we can see tests rise to about 5,000 per day.
Thank you. It's a good question. And we knew that when we were going to ramp up, and extensively when you're doing that, it's not just simply asking people to start doing something that they've been doing more of already. You have to get the new equipment out there. You have to get the proper reagents. That's the chemicals you use in those processes. You then have to do the preliminary testing and do quality checks because one thing besides not doing enough is to do some and do them in error, and you have to go back and search and find the ones that you missed because the quality checks weren't put in place. So while it does take time, because usually this would take us normally 4 to 6, almost 8 weeks to get up and running, they're trying to get it up in 2 weeks. So you can imagine how hard they're working around the clock to try and get these other aspects up and going at this time. So they've moved quickly from where they had, remember, a long time ago, it seems, 2 weeks ago, our maximum was 1,000. Then we moved up to 1,900. Now we're moving just underneath 3,000 in that aspect there. And we hope to get that 3,000 firmly by early next week, and then head to 5,000 by the end of the week. So this was contingent. Also, we had a limitation of all the supplies that are needed for that, such as the special kits, and that was running short. But then we had the large purchase and obtainance by the federal government, and we received a large order on that, so that is no longer an issue. We're working hard on obtaining enough reagent to make sure that's there. So it's all the components, the staffing, the training, the equipment, the reagents, the test kits, and the data collection and moving of the samples around are all part of it. That goes in parallel with our assessment centers that are carrying out their duties and responsibilities to make sure that all the testing is done correctly in the right way. So these do take time. We're running as fast as we can to get those up, but we don't want to then make mistakes in that process and trying to ensure quality, that our positives are positives and our negatives, we are fully confident are negative.
Okay, follow-up?
Yeah, so workers they have as well to serve the population that needs their
that will need their help over the coming weeks and so on. The province has sent out a guidance to healthcare workers who are coming back and says they can choose to self-isolate, but they don't have to. Will you prioritize testing for these healthcare workers who will be in close contact with lots of positive people?
Okay. Yes. First, let me clarify what the memo I sent out was not exactly as you said. What I said that people who come back, healthcare workers who are back traveling, if it's been within 14 days of entering back into Canada or their contact with a known case in the last 14 days, they are supposed to remain in isolation in the home setting during that time. So, but we did say if there are some positions that are agreed on ahead of time that are critical in the operation of a facility, that if all the parties agreed those are critical positions, they could, with the person still asymptomatic and with proper monitoring and wearing proper PPE on the job, have that person resume duties before the 14-day period. That's only with a number of checks in that idea there. One, it's critical. Second, the person is asymptomatic. And third, there's a proper protection and monitoring of that person while they're on the job. Now, the other point you mentioned there is important to us, is that when there's healthcare workers for other reasons are at jobs and they didn't have any travel history, didn't have any symptoms, had back 14 days, and if they feel unwell before coming to work from other reasons, because there's other infections going around, there's other respiratory conditions, there's a sense that they want to make sure they're tested and assessed, especially if they're working with very high-risk patients, or if there's something related to cases and contacts on the hospital ward, they want to make sure they're handled and tested, and they want it done in a very quick time. That's why in our load of tests, we want to prioritize those to make sure those are, I guess, expeditiously moved through, because it has major implications on the overall health of the workforce, as well as the operations and functions and the health of the patients in those facilities. So we have set up systems to make sure those are received quickly, tested quickly, and that means if you may jump the queue in a sense to make sure those are handled, because we do need to know those in a very timely fashion.
Okay, next question.
Your next question comes from Rob Ferguson with the Toronto Star. Please go ahead.
Hi there. I'm just wondering, how many people do we have in hospital today with COVID-19, and how many are on ventilators?
We didn't get that data from the hospital today. As you know, yesterday we had about 20, and that changes. So there's admissions, and they're coming and going in there. And if I recall correctly, in one area they had 4 in ICU, 4 on vents. There's a couple of others. So they get taken on, they get taken off, and they try to remove them. So that can change by the hour as they try to wean them off or place people back on. So unfortunately, Rob, we don't have the data from the hospitals yet today in that regard with us.
Follow up?
Thanks, Doc. Yeah, just a quick follow-up. With the huge backlog in testing, and the Premier saying today he's waiting for advice from you on whether he should order more stores to shut down and maybe perhaps go to just essential services, a lot of people are wondering, are you basing your decisions on these results that we have now with a backlog of 7,000 or 7,900 tests or 7,200 tests awaiting? So are you making all our decisions on like week-old data? Because it looks like we're about a week behind on getting a lot of these tests in.
Well, we're moving quickly to work those through, because as you're adding those 7,000 that you see there, we received over about 38,000 or 3,800 yesterday. So then the 5,000 yesterday were moved back through. So it's not all a week old in that regard. As more and more tests come in, that number grows a bit, but it doesn't mean there's some sitting there from over a week ago. So it's like a revolving door, or like a bathtub with water coming in and water going out in that regard. On that basis, that we have some other of our new satellite sites, they're doing their tests and they're working them through, and they don't have any pending because they're very much new in the process. That helps also, and we have our ongoing surveillance that we're doing with our hospitals, EDs, and long-term care homes. So we're being informed by a number of databases. We also have the information from our assessment sites, also from our ED visits, how many people are going in, how many people are being admitted, and we have those on our dashboards being put together to see if we're seeing surges and directions there as well. So while we have the lab testing, it's not the only metric that we look at when we're seeing this. We also have feedback on how well aspects are being adhered to, and yes or no, in the community setting. And the key thing here about closing down a number of centers is, there are essential services, and we're doing a list on that, both in Ontario, and we're looking at it on a national basis as well, so we can be consistent, if we can, with our federal counterparts. And in that, then we're saying, well, if those services are staying open, they're staying open for a reason, and the public at times need to access those. Of course, they're not in isolation because they're a positive case, because they're not supposed to go out. If they're just home, staying at home and social distancing, they can go out. But that doesn't mean they do not continue to do social distancing. And that means when you go to those retail centers, you do that, and you respect the retailer is trying to do that as well, because they're some of our workers, and they've gone out to serve the public on those essential services. So it's important that they are respected in that regard, and you need to respect them that way. If there's essential other services that you're doing that there's no way you can maintain social distancing, you have to ask yourself, is that really essential? And you probably shouldn't be doing that. And so, like some of the examples given, and when we talked to Dr. DeVille about in Toronto, they gave those as, for instance, for example, and I think there were good examples that it'd be very hard for me to imagine how someone would get their hair done from 6 feet away. So I can see why that does not make sense. And so how many people are hearing to that? And then we hear maybe some reports more and more. If there's people not obliging, then we have to take some more strident steps and measures. So the data, I think from many sources, is going the way we think it's going. We really feel that backlog as more and more tests are coming in, which we wanted more tests coming in. As that turnaround happens, like you can see now, you would say, well, you could have 3,000, 4,000 pending, and they all just came in yesterday, even early next week. And so we want to even pick up that pace even quicker. So while we have some pending, I don't think we're that far out of date. And the other sources reassure me that we're continuing to monitor the situation along with all our 34 health units, our regional OH offices around the province, and our hospitals and institutions, as we watch many different ways to see how is it moving and what is happening in Ontario.
Okay, next caller.
Your next question comes from Eva Lukes with CBC. Please go ahead.
Well, hi there. We're just curious, how many ventilators are currently in use in Ontario and available? And then how many would the province need to feel like they could accommodate patients given a worst-case scenario situation?
So you asked me how many are in the hospital right now and in use. I don't have the data in front of me. A number of the larger facilities have quite a few of the ventilators. They use them all throughout their facilities. How many patients are on at the moment is like Rob had asked earlier in that. And as of the other day, I think there was 4 or 5 or 6, but that can change very much by the hour in there. We had already in stock another 200. We've ordered more, and we're trying to repurpose and ask our manufacturers, as the Premier noted, they can start to build and manufacture others as we speak. So it's a dynamic process, and it's good to see that all this extra stock is being moved on, not just saying, well, 200 is good enough, let's go for 300 or 400. So we have those in reserve to the hundreds that are already out in the hospital sector.
Yes, there have been some comments from private practices, private surgeons, saying that they would donate their ventilators. Is that something that the province would consider taking?
We've heard that. No, we've had a lot of good suggestions from many parts in different sectors coming forward with good ideas as their practices have shut down at the moment in that regard. We've heard from some dental experts as well that they have some available. So all these are suggestions that we're not going to ignore, and it's great to see them stepping forward and making that not only knowledgeable to us, but available to us in the province.
Okay, next caller.
Your next question comes from Morgan Campbell with Global News. Please go ahead.
Hi, Doctor. I just wanted to know, what's your response to people who are still waiting for test results for COVID-19? It's been it's been communicated to us that some people are waiting upwards of 4 to 5 days. And if there's a backlog, what would the true reflection of the numbers be if there's legs in getting those results?
Let's have Dr. Yaffe answer that.
So I certainly sympathize with people wanting to know their results as soon as possible. And as was mentioned, the lab tries to prioritize results for healthcare workers, people in long-term care, or people who are hospitalized. So if somebody's already been tested and told to go home and self-isolate, the most important thing to do is to assume they have it until they hear they don't, I would say, and act as if you have it, which is to self-isolate. Make sure you're washing your hands really well. Don't go out. Get other people to help if you need food or whatever. And if you're starting to feel worse, contact your primary care provider. Or we also have now a self-assessment tool online that will help people determine if they should do anything different than stay at home. But at this point, there really is nothing different that they need to do.
Okay, follow up?
Do you suspect that the numbers then could be higher because of these test results being delayed?
I mean, it's possible, certainly possible. The numbers are going up each day. The percentage positive is still very low. Last time I worked with the lab people, it was around just over 1%, I think. So hard to say, but I mean, we are expecting to see more cases.
Okay, next question.
Your next question comes from Carly Weeks with the Globe and Mail. Please go ahead.
Hi, and thank you, guys. I'm speaking to some health experts who say that the lack of testing and some of the backlogs that we have in Ontario are putting us on the same trajectory as Italy if they look at the case numbers. Just wondering how concerned you are about that possibility.
I think the comparison there, we're always watching to see how we compare with other ones. The aspect you're asking with projections based on modeling and looking at what does that mean in that regard. I think part of the other measurements when we compare is, of course, how many admissions we're getting, how many intensive care patients, and how many deaths, watching that. So we're always asking ourselves those questions. We're looking at that. As I said to an earlier question, the number of tests that we're doing daily is informative. There's various things to our other surveillance methods. So we're not looking at only one source of data. We're looking at multiple. We're following our syndromic surveillance system in the province of Ontario, which monitors daily, and sometimes even more frequently than that, almost hourly, the flow of clients coming through all our emergency departments and compared to the running averages. And so we can see sudden shifts in that, if that was occurring. And I think if we saw the situation starting to resonate like Italy, we would see our ED department starting to be deluged with lots of severe respiratory conditions, which we fortunately have not seen yet. It doesn't mean we're not looking for it. It doesn't mean we're not going to watch for it and prepare for the event that we might have it. So the modeling aspects and the discussions around that are useful. It continues to challenge us with asking ourselves, are we prepared for scenario 1, 2, or 3, and different ones in there. And in that regards, we look at those and we consider all the options and prepare for the possibility of each one of those if it might and could occur. But we deal with what we're doing with today, but plan for the possibilities.
Follow up?
And I've been speaking to some research labs who say they're mobilizing and they're ready to help start doing some of the testing. Just wanting to know, is that something you guys are working with? Are you talking to other labs, basically how to get that capacity up outside of the public health system?
That's a good question. And again, just like with the ventilator, it's great to see that they're ready to step up and move forward. You have to understand if they're going to move in that direction, they don't have the exact equipment in hand. So we'd have to obtain some of the equipment. We'd have to obtain the proper reagents. We'd have to train up the staff there. So we want to first do our expansion out to our hospital sector in there because they tend to be mostly attached to our assessment centers or close by, so we can be efficient and effective in that monitoring. But as these go on, we would not exclude that as a possibility, and that all depends on, because every time you open up more and more, your core key people are taken off from doing their part to do all that training and uptick, if you may, of those centers, and we can only stretch those people so far, so we have to keep expanding out in our first one, which, as we said, we go from 10 and we're hoping to 5 and even up to 10,000. So we're looking at all possibilities, and we would not ignore those suggestions.
Okay, next caller. Oh, sorry.
Your final question comes from Sarah McMillan, CBC. Please go ahead.
Hi, thank you. My question is about personal protective equipment. I'm just wondering about what the supplies are like in hospitals throughout the province, and if there are concerns about hospitals running out of essential gear such as N95 masks.
So, well, we both can say something on that. The personal protective equipment is a major discussion we're having all the time. We know that a number of the facilities have supply, but they're looking at projections what if, and do we have enough for this scenario and that scenario, and they'd like to have enough for all scenarios. The main thing we have to do, as we did before, is to put out directions on what should you use for what aspects, and we want to make sure that people not only are protected when they need to be protected, and they do it right and do it correctly and do it every way, but there's also the supply there when they do need to do it, and so we're trying to encourage that. We're ordering and going after ordering. The federal government's going after it, so we're firing on all cylinders to get as much supply as we want, so we don't only have enough, we would like to have an abundance if we could, but we're going to have to continue to do it in a conserving way and to make sure that those need it get it and need it when they need it and not have to wait. And so we have a long list of people with their orders that they're looking for. It's much beyond their historical ordering status. A lot of it's going through quicker because people are using it, I think, a lot more assertively and maybe from apprehension on that basis there, but some are doing it because there's a little more workload, there's more cases coming in. So we're trying to work at that. It's one of our major thrusts that we're doing, that not only, as the Premier's alluded to, but also the Minister and our government and all the governments across Canada, we're all driving to ramp up that supply on a writ large basis.
Okay, follow up?
Yeah, when it comes to ramping up that supply, I'm just wondering, are you looking into what industries that might already be using these masks might be able to assist in providing those masks for healthcare workers?
Absolutely. That's part of what's happening. I'll give you one example. We've been contacted by some dentists saying, we have a lot of masks. Right now we're not doing elective procedures. We are willing to give them to you. So it's masks that are not being used elsewhere, plus manufacturing companies that could potentially produce more.
Okay, thank you very much. I believe that's the last question. Thanks.